This bite size is designed to be used alongside the ELC Keeping Children Safe practice notes. This has been developed in partnership by the ELC Improvement Team and Scrutiny colleagues leading on the SIMOA Keeping Children Safe campaign. In this session, we will look at some of the ways in which staff can ensure children are safe when in their care. When we refer to your responsibility, we are referring to the adults responsible for keeping children safe. Remember, everyone providing and delivering a service has a responsibility to ensure children's health, safety and well-being at all times. This includes providers ensuring that staff receive robust learning and development opportunities, including effective inductions for new staff. The Scottish Social Services Council Codes of Practice sets out clear standards that those providing care for children are expected to meet. 4.3 states take the necessary steps to reduce the risks of people who use services harming themselves or other people. Through our scrutiny work and notifications of incidents, we know that children have sometimes left a group when on an outing, left the setting, or been left behind during times of transition. This has gone unobserved by the adults responsible for these children, and some children have been found by members of the public. Children who are unsupervised are at risk of coming to serious harm. SIMOA the elephant reminds us of the 5 key things to think about when keeping children safe. These are
safety, inspect, monitor, observe and act.
We will look at each of these in turn and think about ways staff can support children to keep them safe. Safety. Children are curious and creative, so you need to be thinking of all the possible ways in which they may be at risk whilst in your care. Some of the incidents which have taken place include children have used loose parts to climb over fences to get out of the nursery garden because they saw something interesting at the other side of the fence. Children have climbed out of windows or open gates onto busy streets with lots of traffic because they wanted to go to the shops or home. Children have been lost on outings and staff didn't notice that the child had went to explore elsewhere. Children who were not familiar with the nursery routine have been left in the playroom alone while everyone else had went to the dining hall. It's important to be connected to children and understand their emotional needs. This will help to understand what children are feeling and the reasons why they may want to leave a setting.
My dad is working at home. I want to be with him. I don't know this place. I'm going to find my friend.
Children should be supported to be curious and creative. Look at the environment and consider how children can explore, climb, and develop their ideas safely. Let's not forget that some children enjoy the fun of hiding from adults too. Consider how children are supported through the nursery routines, including planning how children will be kept safe during trips and outings. Having a clear system for monitoring and supporting children is crucial to ensure that children are always accounted for. This will help everyone understand their roles and responsibilities. This might include enhanced staff communication, additional support to children, head counts and deployment plans. Consider the opportunities to chat with parents and carers at key times of the day. Think about where these conversations happen. Better not to be at an open door or gate. Inspect. These can be things such as unsecured doors, fences, gates and windows. Easily accessed door release buttons can be tempting for children, as can spaces and fences where they can easily squeeze through. You can identify these by walking around your setting, observing and responding to the environment and children's needs across the day. Also consider windows in playrooms and toilets. Are they secure to ensure children could not climb out of the window? Assess different areas of the setting, both indoors and when outside, to identify where there may be areas more difficult to observe children. Respond to this and reposition yourself where needed to support children's play and learning whilst keeping them safe.
I'm gonna hide in here where it's nice and quiet.
Monitor. Trips and outings, or moving from one place to another, can present a potential risk where children can be left or leave a setting alone. For example, a change of building for lunch or moving from inside to outdoors. Ensure you can understand your responsibility and accountability for the children in your care. Systems such as head counts before, during and after outings or movements to other buildings should be undertaken. Do you know how many children you are responsible for and where they are throughout the day? Are you confident that you understand and can meet their care and support needs? How do you ensure that children are accounted for at all times? For example, if there are 8 children in your care on an outing, how do you make sure that 8 children return? The importance of teams communicating and working together with clear roles and responsibilities is vital, so everyone is confident in supporting the children to keep them safe. Observe. What are children's feelings telling you? Take time to observe and get to know the children, particularly those children who are new to the setting. If they are sad and unsettled, take steps to reassure them and make them feel safe. The setting, the children and the adults are new to them. It can feel overwhelming and uncomfortable for some children. This could make them more likely to try to find a way to leave as they want to go home. Stop and think about what you can do to support children's well-being and emotional attachment.
I need a cuddle, but I don't know anyone here.
Children who are happy and excited may want to explore other areas, so be aware of this and ensure their needs are met with engaging and exciting play and learning opportunities. If children become bored and disengaged, this is also another key time that they may attempt to leave the setting or group and look for something more exciting to do. Stop and think about what you can do to keep children's attention, interest and engagement. Pay particular attention to children with additional support needs, including children who are not yet able to verbally express their needs, wants or wishes. What support do they require throughout the day, and are you clear on this? Do you have a shared understanding about how to effectively support and supervise all children in your care to keep them safe? Is there a clear personal plan in place identifying how to support them and reduce any risks, while providing high-quality play experiences? Take the time to observe and understand the needs of individual children. This plays a key part in knowing how to help children understand potential risks while supporting them to maximise their play and learning. Act. In order to keep children safe, what will we now do differently to prevent an incident where a child may come to potential harm? What are early indicators of risk, such as environment, the activity, or children's emotional and individual support needs? And what action will be taken to safely address these? When an incident has occurred, what you have learnt, who you have involved, and what action have you taken to prevent this happening again? The Keeping Children Safe practice notes and this bite-sized session highlight questions to prompt and support discussions and reflection on practice. Use these to help you consider how can you prevent an incident where a child may come to potential harm. Reflect on current practice, identify potential harms and take action to prevent these incidents happening. This is the most effective way to ensure children's health, safety and well-being at all times. All incidents must be notified to the Care Inspectorate as soon as possible and within 24 hours of the incident taking place. For example, where a child has left a setting, been lost on an outing or left on public transport. Where a child has attempted to leave the setting and this has been discovered quickly before they have left the care of the adult. This should also be reported as an incident. For example, if a child has not left the premises but has been left out in the garden unsupervised, then this must be notified to the Care Inspectorate. Notifications can be submitted through e-forms. These should include as much detail as possible about the incident as well as any action being taken. Ensure this includes any discussions or communication with everyone involved. The Keeping Children Safe practice notes can be found on both the Care Inspectorate Hub and the ELC Improvement Hub.
Scan the QR codes to see these resources.